Welcome from Iram. Today we will discuss foot and diabetes. This is first part of the presentation for foot care in diabetes. Our feet have skin, nerves, blood vessels, bones, joints and muscles. Diabetes can involve virtually any part of the feet. However, involvement of nerves and blood vessels is very important and very common. Diabetes is the commonest cause for loss of toes or feet through amputation, and it is also the commonest cause for people being in wheelchairs due to loss of feet. Now, in the early stages of involvement of the nerves in the foot, you can feel tingling feelings like pins and needles in your feet. Later on, the sensation in the feet decrease because of loss of nerves in the feet. Now, foot loss in diabetes, which is extremely common, can be prevented by simple measures that we describe here. You should always wear a footwear when you are awake and not in the shower or something. Since the foot sensation in diabetes is decreased, you may be hurt by sharp objects on the floor, for example toys. You may not even know about this small injury or small cuts in the foot because of loss of sensation. Wearing a footwear all the time when you are awake will prevent these small cuts and injuries. When you look for footwear for diabetes, make sure it is not too tight or too loose. If it is too tight, it will squeeze your feet and decrease circulation in your feet. If it is too loose, it will predispose you to falls, tripping and falls. So wear a footwear which is well fitting and comfortable and which does not squeeze your foot or your toes. As we said, let the footwear be neither too tight nor too loose. Also wear cotton socks throughout the day because cotton socks give better grip on the footwear and they also absorb the sweat. Nylon socks, on the other hand, do not absorb the sweat as well and also do not give such a good grip on your footwear. So wear cotton socks all the time when you are in the home or when you are going out, and it will help prevent injuries to your foot. Now, many diabetic patients cut their own toenails. That is not right because your vision is decreased. Diabetes interferes with a person's vision after a few years of diabetes. Your foot sensations are decreased, and as a result it is very common for diabetic patients to make small cuts and injuries to the foot. These injuries get infection in them, and because of loss of sensation the patient doesn't even know about those infections till the infection has reached the bone, and then it is very difficult to treat. You may need months of antibiotics and your toe or foot may even have to be amputated. So if you have diabetes, you must ask your foot doctor or the podiatrist to cut your toenails. They have instruments which are not sharp as seen in this picture, which sort of grind away the nail rather than cutting the nail, and that's why there are less chances of injury to your foot when cutting the toenails. As we said, since the circulation is weak in diabetics, the injuries can grow, the infections can grow, and the injuries heal very slowly. And if the blood sugar is high, it also predisposes to more infection. This is end of part 1 of presentation on diabetes and your feet. Please listen to part 2 of the presentation to fully understand how you can take better care of your feet. Thank you.